Hello and welcome to CareCrafts Project Fremont's second research report video. I am Aditya Ramesh and today's topic is Sjögren's disease. This chronic autoimmune disease affects an estimated 4 million Americans, with women being the vast majority, accounting for 9 out of 10 cases. Whether you're someone living with Sjögren's or just here to learn more, this report will provide comprehensive insights into this disease. We will explore symptoms experienced, causes and effects on overall health, and the treatment options.
Since Sjögren disease is a disease that attacks saliva glands, symptoms usually relate to dryness of the skin. Many people have experienced symptoms like dry eyes, describing it as there being something grainy inside their eyes. Other patients have described symptoms like a dry mouth, where the lack of saliva makes speech difficult. This disease also leads to decreased tears and saliva, which can make the previous symptoms even worse. Other symptoms include joint pain in the form of swelling and stiffness, swollen saliva glands in the back of the throat, skin rashes, a persistent cough, frequent nosebleeds, and prolonged fatigue. This disease also targets mainly women, so a very common symptom is vaginal dryness. These symptoms are known as sicca symptoms. While Sjögren disease is known for its physical symptoms, it also has a psychological effect as well. Depression and cognitive dysfunction have also been related to SS, and as more research is published, these two signs seem to be profound. However, the studied neurological disorders are signs for primary Sjögren symptom and PSS. Secondary Sjögren symptom is triggered by the autoimmune diseases and therefore may or may not have any physiological signs.
Sjögren syndrome is an autoimmune disorder where the body's immune system mistakenly attacks the body's tissues, specifically targeting the glands that produce tears and saliva. This causes the reduction of moisture in the eyes and the mouth. The exact cause of Sjögren syndrome remains unclear, though genetic and environmental factors are believed to contribute. Certain genetic variations, particularly those involved in immune regulations, have been linked to an increased risk of developing the condition, such as variations in the serotonin transporter genes 5-HTT and SLC6A4, and the tumor necrosis factor receptor 1 gene. These are both genes that help with immunity and protection and aren't as prominent in those with SS. While researchers understand the genetic predisposition to the disorder, the immune system's triggering mechanism remains a subject of ongoing investigation. The immune response in Sjögren's syndrome can extend beyond the glands that produce moisture, particularly affecting other organs such as the joints, thyroid, kidneys, liver, lungs, skin, and nerves. Despite the complex interplay of genetic and environmental factors, there is no guarantee that someone with an autoimmune disease or specific viral infection will develop Sjögren's syndrome. Nor does having Sjögren's syndrome automatically lead to the development of other autoimmune disorders.
Although there's no cure for Sjögren's disease, many treatments can help. Sjögren's disease greatly affects the eyes. In mild cases, a simple eyelid massage can help, but in more moderate cases, eye drops need to be used, and in more severe cases, a simple procedure known as functional occlusion is administered, in which a plug is placed to drain the eye drainage. Another common symptom is dry mouth. Sucking on hard candy, chewing gum, drinking water more often, or using sprays and lozenges can help. In severe cases, drugs such as pilocarpine or sibutramine can be used, but with the side effects of increased sweating or urination.
Sjögren's syndrome remains a significant challenge for those affected, impacting their quality of life with symptoms like dry eyes, dry mouth, and joint pain, as well as the potential for severe organ involvement. While a cure has yet to be discovered, ongoing research and the efforts of organizations like the Sjögren's Foundation are driving progress. Their dedication to raising awareness and supporting individuals with this condition is crucial. We can contribute to a future with better treatments and a deeper understanding of Sjögren's syndrome by supporting these efforts. Thank you for watching and stay tuned for our monthly video updates.